Hi, I'm Cheryl Pederzoli, Marketing Leader at AGS Health. Today I'm joined by Lindsay Porter, our Vice President of Clinical and Coding Solutions, and Amanda Dean, Director of Clinical Education here at AGS Health. Today we're going to talk about clinical denials and appeals. Welcome, Lindsay and Amanda. Thanks for being here today. Amanda, from your perspective, what are the underlying systematic issues within the healthcare organizations that often contribute to clinical denials?
Sure. There unfortunately are many systemic issues. I would say you could split them into two main groups. The first group would really be on the side of the hospitals and the providers themselves. It's just a reality that physicians and other clinicians are not trained when they go to school to get their degree about how to prevent denials and how to document according to payer guidelines and everything that they're looking for. They're trained to care for the patient and to take care of them. The documentation that they provide is for themselves and of course, the patient record, but it's really all about continuity of care, communicating important information to the next provider or group of providers that may work with the patient. And there is a disconnect many times with the information that they're providing and what the payers on the other side need or want to see in order to approve the inpatient or other type of admission. On the other side, payer behavior is a huge issue that hospital systems are having to face, and it continues to get more aggressive each year. Particularly what we're seeing a lot of lately is these denials stemming from an automated review. So really no real nuance, no real clinical eye is doing a first pass on these cases. There are these bots behind the scenes that's picking and choosing and kicking back a large volume of denials. And really the administrative burden that places on hospital systems and providers is truly astronomical. And again, their focus is direct patient care. And so the more denials that they have to work through, it's just making their job much more difficult. And absolutely.
What key proactive strategies should healthcare leaders implement to effectively manage and, more importantly, prevent clinical claim denials?
Well, education is always going to be the number one key to prevention. Education. I don't think I could say it enough. Really aligning all of the teams, particularly the providers, but also other members of the team, to know what these payers and Medicare are looking for to approve these claims, and making sure that they can align their documentation appropriately with those guidelines that they need to document. Data is also another huge piece of that, being able to look into the activity, what's starting to become a trend before it really runs away and gets away from the team. Really, denial prevention is a team sport, so having both your clinical team as well as your finance team on the same page, speaking the same language, understanding they're all aligned to this common goal is really huge.
For hospitals that may be struggling with a high rate of clinical denials, what would be your initial recommendation for turning the tide?
Sure, back to data. Absolutely, data is king. So really trying to drill down into the root causes of those denials. Every hospital or hospital system is going to be facing different challenges. They're going to have a different payer mix, but really getting down to the reason behind the denials. Is your hospital system dealing a lot with readmissions denials maybe? Is your hospital maybe seeing a lot of claims being what they call denied for level of care? So are they saying the patient should have been observation instead of inpatient? Really having good insight into what those specific reasons are is going to be what can help you get your arms around the runaway train that is clinical denials. It's also very important to evaluate if your team has the adequate resources and knowledge to address the volume of denials. These cases are complex, and the criteria, the goalposts keep moving. Everything is ever changing. And so really it's worth examining the capabilities of your current team, and if you find that your needs aren't being met, considering if a partner can help you address those needs.
Lindsay, how can partnering with a outsourced global services specifically help healthcare organizations in appealing clinical denials effectively? What advantages do they bring to the table?
From a global outsourcing perspective, the number one advantage for sure is labor arbitrage. So we know our U.S. providers are facing a shortage with nurses and physicians. And so when we get to these non-patient care roles, we find that either the facilities are paying overtime or these nurses and docs are working on the side as a second job to fulfill these roles. And so by having an offshore partner with full-time resources, this is a great way for cost savings for organizations.
Lindsay, what are some key steps or due diligence that providers should look for when selecting an outsourced global provider?
I would encourage any provider to absolutely do their diligence in selecting a vendor for their offshore partner. Number one would be to understand the experience of the team, not only the actual folks working on your project, but also the company as a whole. What is their experience in this space? Speaking of the team, meet the team. What are their qualifications? What education do they have? What type of training was provided so that they can help you in this endeavor? Meeting the team. Appealing denials, sometimes you have to go back to your providers or work with your peers to be able to come to a resolution. And so being able to meet the team, these are real resources, real people, physicians and nurses supporting you and your organization. And so the ability to meet them is really important to make sure that they can fit in with your team. And then lastly, the value. Is this solution the best for your organization? So value is subjective to each organization and how it meets their needs. And does the solution being offered have the technology and services components that work for you and your organization?
Thank you, Amanda and Lindsay, for talking with me today and sharing a little bit more about clinical denials and looking for an outsourced partner.
Great, absolutely. Thank you
for having us.